Good afternoon, everyone, and thank you so much for joining us for our fourth session of NACo's Information Session Series for the American Rescue Plan State and Local Fiscal Recovery Fund, specifically focusing on the U.S. Department of Treasury's final rule for the Recovery Fund. Today, we will be talking all about eligible uses of recovery funds for the public health response effort. My name is Erin Hurley. I serve as the Deputy Director of Government Affairs for NACo, and I am joined by our Associate Legislative Director for Health, Blair Bryant. So typically what we've done before is that we will go through a couple of the key highlights of the guidance, and then I will turn it over to Blair to get into the weeds of that public health section within the final rule. And then, of course, as always, we will save time at the end to take some of your questions. So when we're talking about some of the key highlights of the final rule, there are 10 on this screen here. So first and foremost, number one, the final rule is effective on April 1st of 2022. However, counties can actually start taking advantage of the final rule's flexibilities effective immediately. So the final rule was released back in January 6th, so just a couple of weeks ago. So you can start taking advantage of those flexibilities. However, if your county would like to continue operating under the interim final rule until April 1st, you can do that too. So you do have two options right now. So long as you are spending funds that are in compliance with either the final rule or the interim final rule, your funds will not be recouped. But just know that April 1st, starting then, the final rule is the law of the land. The second key highlight is that the final rule allows counties to use up to $10 million of their recovery fund allocation and use it towards the lost revenue category, making it so you can use all of those funds for the provision of government services. This was a huge priority that NACo worked closely with the Department of Treasury on. We advocated for it very, very hard. So we were extremely happy to see that it was included in that final rule. So again, you can allocate up to $10 million towards lost revenue without actually having to do that revenue loss formula. Number three, also in regards to revenue loss, is that there were improvements made for the revenue loss formula, actually. So you can actually include additional funding streams and the formula itself, the growth rate, the default growth rate that Treasury uses was updated, which I'll go into detail in just a second. The final rule also provided clarification around eligible and ineligible capital expenditures, and what, if you choose to invest the funds in this way, what the requirements are for reporting on those capital expenditures. Moving on to some updates in the negative economic impact section of the final rule. You may remember under the interim final rule that counties were able to provide a broad range of services to communities within qualified census tracts. So what the final rule does to ease that administrative burden when you are reporting to Treasury, when you are providing services and aid to these populations, the final rule just pretty much presumes that a household, business, or nonprofit was either impacted or disproportionately impacted. They provide definitions for both of those, and therefore you can just easily start providing those services and aid with a lot of flexibility to those populations. So it really does ease that administrative burden. In regards to premium pay, what it does is that it adds, what the final rule does is that it adds additional employees to that definition of essential employees that are eligible to receive premium pay. And it pretty much just streamlines the process for the administration of premium pay as well. In terms of rehiring local government staff, you may remember under the interim final rule that you could use the recovery funds to hire to your pre-pandemic staff levels. So whatever your staff level was on January 27th of 2020, you could use recovery funds to rehire that staff. Now, under the final rule, you still have that ability to do so, but you can actually hire to above pre-pandemic levels. So you can hire up to 7.5% higher than your pre-pandemic baseline. So whatever your staff level was January 27th of 2020, you can hire 7.5% above that. And you do not have to rehire back for the same positions that you might have furloughed because of the pandemic. In terms of cybersecurity, under the final rule, you were only allowed to use your revenue replacement funds for the modernization of cybersecurity. Now, under the final rule, you can use your recovery funds outside of the revenue loss category also for the modernization of cybersecurity, including hardware and software. For the water and sewer projects, the final rule, kind of simply put, is that it just broadens eligible use of funds for a wider variety of water and sewer projects. So under the interim final rule, what Treasury did was aligned eligible water and sewer projects with that of the Environmental Protection Agency's Clean Water State Revolving Fund and Drinking Water State Revolving Fund. So now they added other eligible projects, including culvert repair, dam and reservoir rehabilitation, and a broad range of lead remediation projects as well. And then broadband infrastructure. What the final rule does is that it actually gets rid of that threshold that it gets rid of that threshold that you had to specifically target certain households and businesses that you had to invest those infrastructure projects in. It lightens that requirement so that you can actually reach additional populations under the final rule and ensure that they have connectivity. Since this is coming up very quickly, I did just want to provide an overview of the project and expenditure report that was released by Treasury and is due for some counties next Monday on January 31st. So the Department of Treasury, the day after they released the final rule, they also released the project and expenditure report as well as the user guide. So as a quick reminder, counties that have populations above 250,000 residents or received more than $10 million in recovery fund awards will be required to submit your first project and expenditure report on January 31st of 2022. And those reports will cover your expenditures, obligations between March 3rd of 2021 and December 31st of 2021. And if you're joining us today and you are a county that has a population below 250,000 residents or received less than $10 million in recovery funds, you are not required to submit a report by next Monday, January 31st. You have until April 30th of 2022. There's no user guide out for you yet. There's no report out for you yet. So just sit tight for the time being. Treasury will release that additional guidance in the coming months. So as a quick recap, these are just the different categories that you can use the recovery funds to invest in. So of course, supporting the public health response that we will be discussing today. You can also use the recovery funds to address negative economic impacts. Of course, replace lost revenue, provide premium pay to essential workers performing essential work, and then invest in water and sewer infrastructure and broadband infrastructure. So what we wanted to do was also kind of frame some of the language included in the final rule. So as you are reading the final rule or the summary that Treasury released, there are a lot of shoulds and musts. So you should associate this with kind of mandatory reporting, use, and compliance of the funds. You'll also see a lot of mays and encourages throughout the rule. So this is much more, it allows county discretion. It's more just federal preference. It's not mandatory. And then the last key part of this is proportional and reasonable. This is very important, especially since we're talking about the public health section. So whatever support that you are providing with the help of recovery funds, it has to be proportional to the impact experienced. And really quickly, the section that I wanted to go over before I kick it over to Blair is the revenue loss section, since it's really the section that we've received the most questions about. So key new features in the final rule. First is that there's that new $10 million revenue loss standard allowance. So to reiterate, counties can allocate up to $10 million of their total recovery fund allocation to spend on government services. So you can simply elect for the $10 million option. However, if you rather not do the $10 million standard allowance, you can continue calculating your revenue loss with the Treasury formula. So now under the final rule, what this means is that 2,137 counties, which is 70% of the nation's counties, are actually now eligible to invest the entirety of their allocated recovery funds in general government services. So of course, very, very, very huge. The kind of second key new feature in the final rule are those improvements to the revenue loss formula. So now you can include your utility revenue as well as liquor store sale revenue in your calculation. Also, you may remember when you were calculating your revenue loss under the interim final rule, you had to calculate it on December 31st of 4 different years. So 2020, 2021, 2022, and 2023. Now under the final rule, you can calculate your revenue loss on a fiscal year or calendar year basis. It's up to your discretion. I will note though, whatever cycle you choose, you do have to pick one and then stay with that option throughout the entirety of the program. And then the last key improvement to the revenue loss formula, and it is very important, is that Treasury changed the average default revenue growth rate. So you may remember under the interim final rule, what you had to do was look back at your county's last full 3 fiscal years prior to the pandemic, calculate the average of those 3 fiscal years, see what the percentage was. You compared it to the average default growth rate that Treasury calculated, which was 4.1%, take the higher between the two, and that helped you determine your lost revenue. So now that 4.1% is actually updated to 5.2% in the final rule. So very significant change because new data was released. After you either decide to elect for that $10 million standard allowance or continuing to calculate your revenue loss, then you can use it on any sort of government service that's traditionally provided by your county. So you'll see on the left side of the screen, there are examples that Treasury provides in their final rule. You are not limited to these examples. So it is helpful to read through these. You can use the revenue loss funds for construction of schools and hospitals, road building and maintenance, environmental remediation. You can use the funds to purchase fire trucks, police vehicles, ambulances, you name it. So very helpful, but it's also a little bit more helpful to focus on how you cannot use the recovery funds because in this category, because the revenue loss funds are so flexible. So you cannot use the revenue loss funds for rainy day or reserve funds, debt service. You can't distribute them into a pension fund either. So here are the key takeaways for this section. So again, you now have 2 options to calculate your revenue loss. Either elect up to that $10 million standard allowance, or continue calculating your revenue loss with Treasury's new formula. So that 5.2% instead of the 4.1%. Also to note that second bullet on the screen, you may remember your county submitting your interim report. We know that many counties did say they put in a $0 amount in the revenue replacement section. So when you submit your first project and expenditure report, whether it's next Monday or in April, you will be able to update that figure. And then also, when you are declaring lost revenue, just make sure that you are still complying with the reporting requirements within Treasury's project and expenditure reports, as well as the uniform guidance as well too. And finally, just to highlight the ineligible expenses for the revenue loss funds. You still cannot use the revenue loss funds and deposit them into a pension fund. You can't use them for debt service payment. You also cannot distribute them into a rainy day or reserve account, as well as using it for a settle agreement, judgment, consent decree, or judicially confirmed debt. And then I also do want to mention, since we've received this question a lot, it's in regards to premium pay. As you know, you cannot use the recovery funds outside of the revenue loss section for premium pay for elected officials. You also cannot use the revenue loss funds for premium pay for elected officials. So I do just want to mention that as well. And then finally, the final rule provides clarity on this. You cannot use funds that conflict with any sort of COVID-19 mitigation practices that are in line with the CDC and their recommendations. And then again, you cannot conflict with any part of the uniform guidance as well, which you also have to comply with, since these are technically federal grants. So that's the kind of key highlights of the final rule and the revenue loss section. But now I will turn it over to Blair Bryant to do the deep dive for public health. Blair.
Thanks, Erin. Good afternoon to everyone if you are on the East Coast. So I will start first with an overview of key changes, and that can be found on the next slide. So basically, we're going to go through what updates were made to the public health category specifically. So we just saw those overarching categories. We're going to be doing a deep dive into the public health category, what changes were made and why. So let's start with why first. And as indicated in the quote on the left of your screen or right, depending on where you're looking, from the guidance, so much has changed since the interim final rule was released. Not only our knowledge about COVID-19, but our tools to fight it and the way in which local communities are mitigating it. So namely, changes were needed in the final rule to address first county vaccination and booster campaigns. So since the interim final rule was released, there's been several iterations of COVID-19 vaccination campaigns, including boosters for both adults and children. Secondly, testing and distribution of rapid tests, as well as other ongoing mitigation efforts. So these include our traditional mitigation efforts, including contact tracing and testing, and infection prevention in key settings, making sure we're targeting infection prevention. Also, the safe reopening of schools, and then looking at public health challenges exacerbated by the pandemic. So we needed to address negative impacts on mental health and substance use, violent crime and gun violence, as well as health disparities and inequities. So the changes allow for flexibility as we continue to respond to the pandemic as it evolves. And then now we're going to look at what exactly has been updated. So looking at the bullets on your screen, the final rule updates clarifications on capital expenditures for the public health response, and I'll go into a deep dive about what those updates are. It enumerates eligible medical expenses. So this was an existing category, but it kind of builded it out more. Expanded eligibilities for behavioral health services, updated eligible uses for responding to violence, and then also broadened allowable uses for impacted and disproportionately impacted communities. And I put a star next to that because I know on the webinar that was held earlier this week, this category went over in detail. So I won't be going over in detail that category, but just wanted to mention it. Next slide. So you'll recall that the interim guidance had several subsections of eligible uses under the public health category. These sections have largely remained the same with the exception of a couple new ones that have been expounded upon, which I've put a star next to on the screen. For the purposes of this webinar and for time's sake, I'm going to focus my remarks solely on those sections that have been added to the final rule or broadened. And I also won't cover the disparities in public health outcomes section. As I mentioned, this was touched upon in the webinar from earlier this week on impacted communities. So I'll also note that expenses to improve the design and execution of health and public health programs, so that is a category under public health. I won't be going over that, but for a discussion on that, you can see the public sector capacity and workforce in the general provision section of the rule. We also talk about it in our final rule analysis, which we can pop in the chat. Next slide. So in the COVID-19 mitigation category, I wanted to revisit this, although this was an existing category. It did provide an expanded list of eligible uses for mitigation that include vaccination and testing programs, which includes flexibility to allow for adaptation as vaccination needs of the community evolve. So whether you need mass testing sites or mass vaccination sites now, or smaller vaccination sites and booster shot areas later, the rule allows for that flexibility. Monitoring, contact tracing, and public health surveillance. This is going to be ongoing and continuously needed during the course of the pandemic. Public health data systems, public health order enforcement and communications, COVID-19 prevention and treatment, support for isolation and quarantine, as well as one of the newer, more expanded categories, transportation to reach vaccination or testing sites, as well as other prevention and mitigation services for vulnerable populations. Support for prevention, mitigation, and other services in congregant living facilities, public facilities, schools, small businesses, nonprofits, and other impacted industries. And as Erin mentioned previously, all of the prevention and mitigation efforts in these settings must follow the CDC guidelines on mitigation and prevention. And then lastly, capital investments in public facilities to meet pandemic operational needs. So specifically physical improvements to public hospitals and health clinics, or adaptations to public buildings to implement COVID-19 mitigation tactics. And I'll go into detail on this in a few. Next slide. So this category was included, like I said, in the interim final rule, but updated to clarify that it does cover costs related to medical care that's provided directly to an individual due to COVID-19 infection. So in the case of treatment, or potential infection in the case of testing. So the recovery funds may be used for expenses to households, to medical providers, or other incurred medical costs due to the pandemic, which include unreimbursed expenses for medical care for COVID-19 testing and treatment, so uncompensated care costs, paid family and medical leave for employees, emergency medical response efforts, and then the treatment of long-term symptoms or effects of COVID-19. Next slide. So again, this category was in the interim final rule, but the final rule clarifies that it covers an expansive array of services for prevention, treatment, recovery, and harm reduction for mental health, substance use, and other behavioral health challenges that were caused or exacerbated by the public health emergency. Of note, counties may also use this eligible use category to respond to increased rates of behavioral health challenges that are at the population level or at the individual level, as well as new behavioral health challenges or exacerbation of pre-existing challenges, including new barriers to accessing behavioral health treatment. This category also applies to special populations such as school-age children in school settings. So the final rule allows for a very broad range of activities in this space, including for the general public, which include behavioral health facilities and equipment, prevention, outpatient treatment and inpatient treatment, crisis care and diversion programs, as well as enhanced behavioral health services in schools, services for pregnant women or infants born with neonatal abstinence syndrome, support for the equitable access to reduce disparities in access, and reduce disparities in access to high quality treatment for healthcare. Peer support groups, cause for resident supportive housing or recovery housing, the 988 National Suicide Prevention Lifeline. So this was a very important ad that a lot of behavioral health advocates advocated to be in the final rule. And then lastly, the expansion of access to evidence-based services for opioid use disorder prevention, treatment, and harm reduction and recovery. So Treasury has outlined allowable uses specifically to address community violence, given the rise of violent crime during and associated with the pandemic. New guidance on eligible uses for this include evidence-based practices like focused deterrence, street outreach, violent interrupters, hospital-based violence intervention models, as well as wraparound services like behavioral health therapy, trauma recovery, job training, education, housing, and relocation services, as well as financial assistance. And then capacity building efforts at the community level for violence intervention programs, as well as strategies to reduce gun violence, which could include hiring additional law enforcement officials, addressing gun trafficking channels, and investing in tech and equipment to aid law enforcement to more adequately respond to increased violence. So wanted to dive deeply and give some further clarification on capital expenditures for the public health response. In the webinar Monday, I know my colleagues touched on general capital expenditures, but I wanted to quickly highlight allowable expenditures added under the public health category. These include improvements or construction of COVID-19 testing sites and laboratories, as well as equipment purchases, COVID-19 vaccination sites, medical facilities for COVID-19 treatment and mitigation, emergency operations centers and equipment purchases. And it also includes adaptations to congregate living facilities and skilled nursing facilities or other long-term care facilities like incarceration settings, homeless shelters, residential foster care facilities, residential behavioral health treatment, and other group living facilities. This also includes public facilities like schools, but it excludes the construction of new facilities for the purposes of mitigating the spread of COVID-19 in that facility. It also includes mitigation measures in small businesses, nonprofits, and impacted industries, and the cost of establishing public health data systems, including a technology infrastructure. Specifically as it relates to behavioral health, the Treasury recognizes behavioral health facilities and equipment. So for example, inpatient or outpatient mental health or substance use treatment facilities, crisis centers, and diversion centers as eligible expenditures, as long as they adhere to the standards detailed in the capital expenditures section. So you want to make sure you're checking what you're doing in that section. So for the last couple of minutes that I have with you, I wanted to quickly provide a snapshot of what some other counties are doing and how they're spending their funds related to the allowances in the final rule. So first, I'll talk about Alachua County, Florida, who's allocating $1.5 million for behavioral health care in specific, and $2 million for urgent care support, as well as $1.5 million to cover medical equipment modernization needs for first responders, as well as $1 million for food security, which I felt was important to include as a social determinant of health. Next slide. Taking a look at Bernalillo County, New Mexico, they're allocating $2.25 million to the Young Adult Inpatient Substance Abuse Program, which is a new program that they're developing in their county to address youth substance abuse. They're also allocating $2.25 million to the outpatient clinic for behavioral and mental health treatment, $1 million to expand wraparound services for families with young children, $9.5 million for services to disproportionately impacted communities, including housing support. And then lastly, taking a look at Gloucester County, New Jersey, and if you're from that county and I messed up the name, please forgive me. They are allocating $27 million for public health specifically, $3.25 million for negative economic impacts, $7.26 million for services to disproportionately impacted communities. And some of their notable projects within these allocations include emerging industry training, a transition to work program for students with disabilities, innovation hubs for small businesses, community peer recovery programs, substance use disorder outreach, and crisis intervention training for law enforcement, all really kind of focusing on the added or expanded allowable uses under the final rule. So with that, I will turn it back to Erin, and we are happy to take any questions that you all have. I think you are on mute, Erin.
Thank you. You would think 2 years into this, right? So thank you so much, Blair, for that deep dive into the public health part of this. One question that we received is in regards to the capital expenditures and the clarification around those items. So I know that you went through some of those eligible projects. Could you maybe just reiterate those, since that is such a significant part of the final rule, just so folks understand that it is both, expansion and new construction specifically for those eligible projects?
Absolutely. So in a nutshell, to summarize that section, if you want to construct, so build a new facility or improve a facility, the allowable uses allow for COVID-19 testing, vaccination, medical facilities, and emergency operation centers to be improved upon and constructed. But for other facilities, you would adapt those facilities. That's an allowable use, but it actually doesn't allow for new construction of like schools or jails under this public health category. It has to be directly connected to COVID-19 mitigation, and it's just for the adaptation purposes, not for new construction, if that makes sense.
Definitely. Thank you. And then we have a next question that we have from Terry Simonson. He's wondering if the purchase of medical equipment such as an AED to aid and assist first responders in public health facilities is an eligible expense.
Absolutely. So all of the necessary equipment, not just for medical facilities, but medical professionals, are allowable uses.
Great. Thank you so much, Blair. And then I think, another question that we often have in terms of the purchasing of equipment and vehicles, I think that's an interesting distinction. So as Blair mentioned, that would clearly be an allowable expense under the final rule. When we're talking though about purchasing vehicles such as ambulances and police vehicles, that's where you would consider using your revenue loss for those types of expenditures. Since that's a little bit different. So that's just a good distinction and to make as you are investing your funds ultimately towards public health. But I think, we just received another question, Blair. It's around, and we can share in answering this, Blair. So the question is, can counties bring on consultants and private partners to aid in the work of determining where funds might be best used, especially with regard to impacted small businesses? So I can take that one, Blair, and then feel free to jump in with anything that I might have missed. So in terms of consultants, yes, counties can use funds to help with consultants who are ultimately administering the program, to ultimately support the effective management and oversight, including consultation for ensuring compliance with the legal, regulatory, and other requirements. So those are kind of around the reporting requirements more generally. And then Blair, we have another question from Trish Startup. The question is, can you discuss what's allowed for 911 services? Are updating towers eligible? So how about you talk about the 911 services and I can touch on the towers piece as well.
Absolutely. So I believe it talks about, yes, so under the medical expenses category, it talks about emergency medical responses as well as emergency operations centers, which includes, of course, 911. So any updates to the 911 system or any updates to equipment needs for 911, infrastructure needs or workforce needs are an allowable use because they are under that emergency operations and response.
Great, thank you, Blair. And then so going off of Blair's response in regards to updating towers, I think you might mean radio towers, but definitely, Trish, feel free to write another response in the Q&A box as well too. But explicitly outlined in the final rule is that there are an eligible use are improvements to or construction of emergency operation centers and acquisition of emergency response equipment. So this actually includes emergency response radio systems, which is explicitly clarified in the final rule because that was actually not clarified under the interim final rule. So in terms of the radio systems, emergency response radio systems, that is an eligible expense. And then a next question we have here, again, in terms of the capital expenditures. So Blair, for example, a county health department, it's not new construction, but additional renovation space, storage, lab space, and other needs. Is that an eligible expense?
Yes, so a county health department would not be a new construction. So if you're actually talking about the physical building, constructing a new building, no, but you can make adaptations and modifications to that building as it relates to the COVID-19 pandemic.
Great, thank you, Blair. Another question we have is, can counties use funds for investments in ventilator inventory?
Yes, so any sort of supply, medical supply that's needed for the COVID-19 response is an allowable use. And going back to the question about capital expenditures, I think a good rule of thumb or trying to figure out what's an allowable use in terms of constructing a new facility versus adaptations or modifications is essentially if you're constructing the facility to upstand some sort of COVID-related activity, so testing, vaccination, medical treatment. So I know in the height of the pandemic, we saw a bunch of people building those small little hub hospital areas to treat people with COVID. All of that would be an allowable use for new construction, particularly because you need it to respond to the public health emergency. So for existing public health buildings and health buildings, as well as general county buildings, unless there's some clear nexus between addressing the COVID-19 response and building a new building, then that gets a little bit more gray. So think more along the lines of adaptation and modification for that.
Great. Thank you, Blair. Another one that we have is around the handheld radios for emergency responders. So Blair, do you want to start answering it and then I can hop in as well too?
Yes. So simply put, any equipment that an emergency responder, a doctor, or anyone dealing on the front lines of the COVID-19 pandemic, any equipment that they need is an allowable expense.
Great, thank you, thank you. I do. This is a question not related to public health, but I did just see a question go in here because it's regarding premium pay. So Sandy Riddle asked for clarification around the fact that revenue loss can it not be used to make premium pay if the person is an elected official. So no, you still cannot use the revenue loss for premium pay for an elected official. We understand that there are a variety of elected officials when we are talking about elected officials. So we are, asking for additional clarification from Treasury on that. But I will note that in the actual interim final rule, it's on page 233, and pretty much the statement is saying elected officials are prohibited from using their official position and control over the recovery funds to receive premium pay. So I do just want to reiterate that as well. Okay. Oh, go ahead, Blair. Go ahead, Blair.
I was going to help direct you. There were a few questions on revenue loss, one on, replacing lost public sector revenue. And then there's one on building a new EMS station. So I can do that if you want to.
Go ahead.
About revenue loss. So with regards to new EMS station, I think it would really depend on the purposes for building the station. The purpose is to increase, have an area for testing or vaccination or booster shots, or have an additional area for COVID-19 treatment, then yes, fully you can go ahead and do it. But if it's just to have an additional space or a new building for EMS, then you would have to adapt an existing building, if that makes sense.
That's perfect. So in regards to revenue loss, we have one question in here from Lindsay Russo. The question is, for revenue replacement, have you heard about whether county procurement rules will apply in lieu of uniform guidance? So uniform guidance, along with procurement, you have to follow CFR 200. That is still something that you have to follow with the revenue loss replacement fund. So just make sure that you are absolutely following those requirements as well. And then another question that we received is, if a county has an increased need for ambulance services due to COVID, would the purchase of ambulances and additional staff be allowable under the public health category?
Yes, so the purposes, the purchase of ambulances, absolutely. Additional staff as well. Yes, although I didn't go over public health staff, that is an allowable use. There's no real updates to the allowance for staff, public health staff, from the interim rule and the final rule. But I encourage you to read that portion of the final rule as well. But yes, that's an allowable use.
And then Blair, I'll actually build off of that response really quickly, just in terms of covering payroll and benefits for certain staff. So what the final rule does is that it does explicitly mention that you can use the funds for payroll and covered benefits for public safety, public health, healthcare, human services, and similar employees of the county government. So the final rule does actually outline and provide examples of what public health staff are, along with human services and public safety staff. So public health staff include employees that provide medical, physical, or mental health services. So think of like medical staff in schools or prisons. Also, any sort of laboratory technicians, medical examiners, morgue staff, any other supportive services that are essential for patient care. And then also, of course, employees of public health departments as well, too. And then we have, we can probably take just one last question here. Or we have two that we can do. So this question is capital expense. What about adding to the county jail? Not a new jail, but creating new isolation space, behavioral health space, etc. But Blair, do you want to take this? I'm also happy to take it as well too.
Absolutely. So jails are included in the congregate living facilities outlined under the capital expenditures section. So you can make any adoptions or modifications necessary to those facilities for the COVID-19 response. So yes, modification, including building out a wing for isolation, would be allowable.
And to expand upon Blair's response as well too, in terms of ineligible capital expenditures, you cannot use the funds to construct new correctional facilities. You also cannot use the funds for new congregate facilities, and you cannot use the funds for construction of convention centers, stadiums, or other larger capital expenditures that kind of contribute to general economic development. And the thought process behind there was that the original reason that the recovery fund was established was to address the negative economic impacts of COVID-19. So general economic development isn't really part of that. But I think with that, we are at time, and we are going to close out the session. If we weren't able to get to your question today, we will absolutely follow up with you. We do have access to the chat and all of the questions. But again, would like to thank Blair for her amazing overview of the public health response section of Treasury's final rule, and of course to everyone that is joining us today. So again, you can get all of our resources on NACo's website. We have a really great analysis overview of the final rule, as well as other helpful resources too regarding revenue loss calculation and so on. But again, thank you to Blair, and thank you to all of you for joining us today. Take care, everyone, and stay safe.